Are we on? Can you hear me? Can you hear me? Microphone check. Lights, cameras. Hit me. This is swanky. This is lifestyle. This is culture. Welcome to the social center of everything culture. Culture Daily.
Yes. Good music, I like it. Good music. You're still watching 3 Music TV. Coming out from Training Live, all the big updates and the stories on there. You know, I was taking a nap, right? And Olele was talking about washing of the the lingerie and I don't know, the laundry or I don't know. But you know, when I become a politician, the things I'll do, it'll be crazy. Because for me, I mean, and that's my man right there, you know. So
he's a man.
Man. My cook is my G. Is my why are you saying?
Wanyadi.
How
come who draws saying?
Hey, but why can't you help your community?
Would you vote for somebody who washes drawers?
Asa, that's why you're on now. Which is a woo. Jack.
But
Ghanaian is a designing African. They say this anime
helping your community.
Gen Z babes are boys. Social media babes are babes.
Person's washing. Want to support?
How about you
support?
Dry? Or you fetch water
how
for the
about
person?
I go to your house, I see Lenny is cooking food, I dip my hand in the food and I eat.
But didn't we
I come
see,
to your house,
I
see you are.
Say right now they've even buried the hatchet. First it was you go and pound for food. You go and
braid hair.
There was Banku.
But let me tell you what, Honorable Mike has been a massive support to the creative aspect.
We need to see that
when it comes to comes to offering free legal services. He's been of massive.
So why doesn't
support.
he use that?
Channel
that.
Why doesn't he use what?
Like this is what I'm good at. This is what the space at which I'm channel that.
But he's doing
because if you've worked. And you've worked to an extent over the period. You don't have to even do anything.
Hold on. I said he's been of great support to the legal, like free legal services to the industry. What else do you want him to do?
No, all we are saying
wake up
is
and be doing free legal services.
No. All we are saying is he should use that to push.
Use what? To push
like
what?
The works that he's done. That should be his standing.
How can you
can't go and be washing.
But hold on, how can you judge based on some one video you've seen somewhere? The person's whole entire career because of one video you saw somewhere. So his whole life. When they wake up every morning, you start.
Okay, we just saw a few seconds of the Fitz video, but it's affecting the whole life career.
What else you are
just like that.
You just open it and you break the table. Like
you are about to have the world at your fingertips because the wait is finally over. Telecel is here. Now you have everything you want and need. Quick and reliable communication. Stress-free money transactions via Telecel Cash. Transforming your big business ideas into success stories. So connect with Telecel and enjoy a world of endless possibilities. With Telecel, I say, connecting energies. And brush your teeth day and night.
You've made it short, eh?
Brush your teeth day and night. With Pepsodent Cavity Fighter. Doc, what is pro-fluoride and micro-calcium ingredients? We've been talking about it about maybe
but these are protective elements that it's good Pepsi brought it up because then it shows your teeth. It serves like a cover over your teeth that prevents cavities.
Cover for cavities.
Punchline, right? Pepsi should use that cover for cavities. But also it strengthens the teeth too. Gives it a bit of strength. You know, sometimes people drink cold stuff and say my teeth hurts. It shows there are nerve endings inside your teeth. That's also sense certain, so you can sense that it's hot, it's cold. There are nerves that help do that. And sometimes you need to protect them from extreme heat and extreme cold.
So it's good to brush your teeth.
Yes.
You know, so not only is it cleaning,
effectively.
Not only is it cleaning,
just put the toothpaste in your mouth and gurgle around and then say I'm done.
They've got this black one. Pepsi has got this black one that I use. I like, the charcoal. It's nice. It puts, your mouth inside don't be black, but when you finish and you rinse your mouth, it's ching.
But you know that charcoal for teeth whitening has been there.
Yeah, but you've got plantain for teeth, you know that.
It's been there for time. It's been there for time. Like, because I remember when I was really young,
the plantain
my
thing,
cousins, there was plantain, the stalk of
And
plantain.
the inside of the peel.
Yes.
So
And
you know
then
Pepsodent's herbal. I'm
charcoal
sure they
is
have all these
there.
things in there, one or the other.
Yeah.
But anyway, so there's 175 gram. Hey, my producer, relax now. Then we are discussing to understand Pepsodent into its intotus. Hey, he's telling me playing this in my ears like I'm confused. Hey, but wait some more. There's 175 gram, the big one. She likes using the big one a lot. Our producer, she's called Debbie. Yeah, she likes using the Pepsodent, the 175 big family pack. The 120 Ejakwa pack, the cereal. Yeah, 65 and 12 gram, the Lenny. Small. She doesn't like this thing. Yeah. So don't just use toothpaste to brush your teeth. Use Pepsodent. That protects your teeth. And lastly, as well, if you want to enjoy a dreamy vacation, fly around the world, get sizzling deals on flights, hotel, airports, you better use Waka Now Ghana. Jump onto their platform, which is Waka Now Ghana on socials, or visit their website, which is wakanow.com.gh as well. You can download the app, which is Waka Now, and or pass by their travel centers in Accra, Kumasi, and Takrady and Tamale. Yes, to get sizzling deals on flights, hotel, airports, and transfers, and dreamy vacations with Waka Now. All right, now recently, in fact, 20 years ago, a long time ago, I got a call from Serial, and he was telling me, about 24 years ago, Serial called me and said that it was vanished. It had gotten lost. I was asking what was lost. Serial said it is lost. He was worried and scared. He said it was lost. So I was asking Serial, what's missing? What's missing? Oh, my brother, relax. You remember? Long time. I said, what's missing? What's happening, Serial? Take it easy. He was crying, frustrated. He says, I can't do it again. And I said, take it easy. So we after he calmed down, and I asked him what was the problem. He said that his neighbor's manhood had vanished. And I said, but how does that affect you? I hope you understand how you have.
Proximity. Yeah. So please,
he
probably hasn't taken his meds. So
I agree.
That's why we have a doctor here.
You know something? So yesterday, right at 10 p.m., I was watching the show again. Look, the show for edit, you have to edit and show it in the evenings. You have to edit and show it. Anyway. So about 20 years ago, this whole vanishing manhood business popped up. I remember somewhere around Nungwa barrier. I was even afraid to go to school because I was in JHS or JSS. I said, what is this thing? They say if you're walking in town, somebody will touch you, and then next thing you know, your manhood is gone. Now, JSS, there, I'm not starting life. Wait till let me enter life some more before you bring this phenomenon. How can you be doing this? However, it vanished mysteriously. And then recently, about some weeks ago or last month thereabouts, again, we've heard stories of people even being brutalized because they have touched someone or stolen somebody's manhood spiritually or I don't know.
Allegedly.
So this morning we said no. We need to understand this from a clinical perspective on the possibility of reduction, and we'll do increments as well as reduction. But vanishing there is a big problem. So, Doc, this morning we said no. We have to reach out to you and try and understand first clinically the possibility or what can lead. Let us just debunk the myth. But what can lead to the diminishing, the vanishing, the
elongation.
Elongation? Elongation is a different conversation for like 9:45. I beg your pardon. Yes, we'll discuss in the last 15
I think we should penetrate
show.
The core of the topic before we
try and even
discuss
allow
elongation.
Is it clinically possible for the manhood or the male reproductive organ, external one, to disappear unprovoked or even shrink out of existence?
Sometimes when there's pressure, it disappears back.
That is the question of the day.
It's all right.
Question of the day.
I'm happy you wore this top for this discussion.
It's all right.
Question of the day.
Honestly, when I started hearing this rumors, and then I asked somebody, where is it coming from? I said, Kaswa. I said, Kaswa again?
Yeah, sorry.
What's going on in Kaswa? Like, for all the strangest of things always happen from Kaswa. But to talk about this thing, the story goes that the guy sells clothes, bend down boutique. The first incident was he was bend down boutique, and two guys who allegedly were from Nigeria or Niger or somewhere came that they were buying the clothes, and then they spoke like they couldn't understand what he was saying. Then they touched him, and then when he realized it was gone, then he started shouting that the guy is taking, the guy is taking. So they take the guy to the police station. The police come, they said issue. They said, oh yeah, we can make it come back. So they do the incantations, everything, nothing comes back.
Was anything missing, or people are going mad? Is it mass hysteria?
Yeah. I think it's mass hysteria because, firstly, has anybody actually brought evidence that it was missing?
Usually, those videos don't trend.
No, I mean, like when you went to a police station,
the police, nobody has ever taken a video of. No, there have been leaked videos around the country.
Apart from that, today
that has never leaked.
The only show.
Today, I'm just going to listen. Let me just say that because
the only show is shrunk.
Yes, because yours
shrunk.
Yes.
So before you can say something has shrunk, it means you have evidence of it being bigger than the way it was.
Wow.
Right.
So this is according to the victim.
Yeah, according to the victim. So now the victims were.
Says that what you do.
I think why
Why dealing it up?
I think I won't disappear in the womb before she come. A long time ago.
So I know they talk.
So is it possible for that to happen? Let's put the myth and then the spirituality and all that away. Is it possible for a male, penis to not to vanish, to shrink, from its size at rest?
Are we saying? Look, there are two options here. The question is sort of loaded because we have instances where somebody is born without it. The instances somebody is born without it.
Okay, no. So let's say
matured,
adult, you guys,
father of three. Father of three. He was on his way to his other girlfriend's house. Performing man, a manly man's man.
No. The question, right? Because the male. The male organ has the tibia can expand.
So we are calling TD.
Yeah, the TD can expand and retract back to its original size. Now we are talking about it at original size. Can it in any way? Is there any disease? Is there any health condition that can allow it to just start shrinking?
Yes.
Maybe we need to understand that first.
Osteopinophilosis.
Yes. Pinophilia.
I don't know about osteopinophilosis.
Pinophilia be what? The fear of what? The fear of
falling off. Doc, you don't go that class. Doc, you don't go that class. Then you go China. You go China that time.
So the thing is that yes, you can certain conditions. There are conditions that can make it reduce in size.
There are conditions that can make it reduce
permanently.
in size.
Yes.
Okay.
For example,
let's talk about those conditions.
Yes, there's one. So you mentioned that we all believe that the penis, when it's flaccid, or the TD when it's flaccid, is a certain size.
For those of you who went to Motown, flaccid means soft.
Soft, okay.
He say you. The thing say that way. He look at me. He say you.
You should ask what the meaning was.
You should ask the meaning first.
Yeah.
I'll tell you.
So when it's flaccid, we know there's certain size, a certain texture. The feel of it is different, right? Now, when blood rushes from your brain and that part of your body into your penis during excitement, then it elongates. It gets longer, it gets harder, right? Now, this blood.
Is that the only thing?
That causes it to be hard.
It doesn't get bigger.
That's what I'm saying. It gets bigger, longer
and harder.
Bigger. Yeah. Than it was when it was flaccid.
He said when blood rushes from your brain, so that means from thought. Okay, from thought. So maybe this morning,
medically your heart.
So maybe this morning, now people have seen you, the thing running from their brain.
That's their matter because
as you are saying, Doc, yes.
So somebody sees lady passing, the person is excited. Blood rushes from certain parts, especially the heart. As clinically is the heart.
It's the heart, yes.
Then, but we always use the brain in the sense that because it makes the person lose thought. Thought triggers it. So so then it makes it longer, bigger. Then you wanted me to add bigger, stronger, tighter, thicker. Yes. Then now the mechanism for this is that there are certain spaces around the penis in the muscular tissue and the blood vessels that run the length of the penis, right? So when this blood rushes, it's under high pressure, enters there, then it causes the muscles there to expand, to get thicker and harder. That's basically how it works. Now, in the sense for it to shrink, right? We are talking about something is going to be in the pathway of this blood.
Yeah.
So you're going to be called strictures can happen, can have certain muscular tearing and other damage to the skin there that can cause the blood rushing there, the amount that is entering there to reduce, which slowly is going to make the penis shrink. Right, that's the first one. So you're going to have issues with that. Now the second one is a condition called pyrogenia. It's a clinical condition where the penis is not getting bigger. The muscle around it is not, how do I call it? Maybe for a layman way to put it, in the sense that you are losing muscle tone. You know, you're supposed to, you do push out, you also get buff. So people actually take this whey protein and things to get buff, to get muscle tone.
Steroids.
Right? Steroids to get muscle tone. Now we're talking about the penis losing its muscle tone, losing its anatomical structure. So it's curved, it's bent, it's not straight.
Okay.
Yeah, that's another condition.
Hey, doc, be careful with that too, because you know naturally some people have curved. Yeah.
So then the third option.
Yeah. What's exciting?
That guy is going to the junction.
Yeah. That's when we're in school. I remember when we go to the washroom to take a shower, because the dormitories the washrooms are open. We don't have like private. Even there are cubicles.
So there's no door.
No, not doors. They are cubicles. So how the prison facilities are, because it was built ancient times. Yeah, like how it was. So like sports facilities, they don't have doors.
They don't have doors. Yeah, you just shower and get out of bed.
You have cubicles, but the cubicles don't have doors.
Yeah,
but the main bathroom.
St. Peter's, they have a bar iron rod. They like freezing. Yeah, we know. So there were quite a number of things we saw. As of course, and I'm sure that's resonates with a lot of other schools as well. So that's when I can confidently say that some people naturally have got, but that has nothing to do with the disease. Okay, all right, sure.
Then the third one is when we take out your prostate during a surgical procedure. Total prostatectomy, we take out the prostate and all that, right? When we take it out, because it's a surgical procedure, and then the urethral length that passes through the prostate to the end of your penis, right? We've shortened it, so it makes the penis shorter, right?
Which limits
the ability to grow.
When they take out the prostate, does the kind of person still get an erection?
Yes, you can.
Okay,
you can.
Just that you've reduced the size of the manhood.
Yeah, you can.
There's no way to take out the
person engaging.
No, if our producer is listening, she can look for an image for me of where the prostate is located, and now it will give a fair idea of how. In order for us to even examine the prostate, it's so difficult because where it's positioned.
Yeah. Okay. Doc, we won't delve deep into prostate because I want us to treat that as a separate conversation later on. Yes.
Talking about the vanishing of the tail.
Yeah. So now these are the three things. So it can reduce in size, but for it to totally vanish, it means you are speaking of when it vanishes. That means that is there a flat skin that is there? There's nothing there.
You see two balls.
So now the question is, how do you urinate? you get what the question becomes, like if nothing at all, how do you urinate?
Yeah.
Because there are instances where your for lack of a better word, your scrotal sac can go in there, can be pulled back in, which can cause hernia and other things, right? There are instances where it can cause a herniation, where it becomes big and all that. But for it to totally go away and disappear, it means that person will lose the ability to urinate.
Right.
Which means that there will be toxins that retain in your body. That's what's come out. So you can't keep this. So it means clinically you have to appear in a hospital. Well, if you can't urinate for about 2 days, even 1 day, it's not going to be easy. So definitely, I feel these cases should have found themselves in the hospital one way or the other. Because it was a week now. If they were real, they would have certainly found themselves in the hospital. Because then, if it's gone totally, when you're all the water you're taking, where is it going to? Yes, your skin can get rid of some of it. Your tear gland can get rid of some. Your inspiration can take part of it. But in the total, the bladder has to get urine and then.
So has there ever been a case that maybe in your work experience, someone has come to the hospital because of any of these conditions that has happened? In fact, the question rather should be, how quick can these conditions, these three conditions you mentioned, happen? Does it happen instantly? Regarding that, let's not talk about the vanishing TDs. Okay. Yes, how quick can these conditions happen? Is it something that happens over time, or
it's over time?
It's over time.
So there are signs and symptoms that you notice before it gets to a certain point, right? For example, some people will come that I'm not able to last long or when it gets erect, it doesn't last long, and then all of a sudden, without any, it just goes flaccid again. Or the person will tell you that the penetrative ability of it has reduced, or it's not hitting certain part that the way it's supposed to be. So there are so many signs and symptoms that will relate to you coming to a urologist, and that's a special department. They deal with that, urology. They deal with all these things.
So what is Koro? Because in the reports, one of the names that, or one of the medical terms that popped off was Koro, and this
Koro.
is
How is it spelled?
Koro. Now it's very interesting because this thing actually happened. It was the same phenomenon in 2007, according to research papers here, and the same accusations. This was even 2005 in the northern part of Ghana, where occurrences of panic attacks associated with belief in genital retraction have been described in the anthropological and psychological literature in terms of culture-bound reactive syndromes, and this similar phenomena is called Koro.
So are they saying it's a psychological term?
Yes. So it is under epidemiology, psychiatric, and psychology, and then I think. Okay, so let me read it. So Koro syndrome is a multi-tiered disease presenting as an overwhelming belief that one's sex organs are shrinking into their body. Now, moderate to severe anxiety attacks are associated with the condition, along with the fear of imminent death. Koro is often culturally related and is most seen as an epidemic form in East and Southeast Asia. So the question is, how did it find itself here? Because this is a research done by National Library of Medicine, which is also the National Center for Biotechnology Information. Jay asked a question. I wanted to add to that in the sense that when he asks how often this happens, I'm looking at how coincidental this thing happens. You wake up in the morning, your tejua is active, it's working. You are going about your business, and maybe you have an underlying disease that needs to be checked, because clearly there seems to be some undercurrents that contribute to the shrinking of the tejua, right?
Very good.
So at what point, how Lenny is standing there and walk past Lenny, no, the tejua is missing.
So you are trying to relate how that motion or that effect,
exactly, like
because
how
the condition was already there. How did that relate that the person triggers that?
Exactly.
All of a sudden, I noticed that.
You notice that your
gone.
thing is, because in some of the,
that's what I was asking about the speed.
How quick does, because if you're saying is a condition, I wake up in the morning, I go and bath, I take it to the washing bay, I clean the tejua, everything is on point, everything is in check, the size, everything on point. I go to work. I go and do my bend down boutique, try to sell my trousers and my phones. Then somebody passes by me. Then all of a sudden,
I realize that it's not
my
there.
tejua has reduced.
Your tejua less.
Hey, Jesus. The tejua has reduced. I am looking at how the timing of the vanish of the tejua, the shrink of the tejua, and that's
the clinical condition.
The clinical condition
aspect of it.
Is it that they didn't know that was always because of the stress, because of the the heat of the moment, rush hour, everybody's trying to sell, so they're not paying attention to it, because what it took one case to lead to another case. This was 7 cases in class 1.
And everybody just realized that,
and all of a sudden there's a chain reaction. Everybody's realizing that this guy passed by me, my tejua. So
there's been an incident,
and usually it's restored afterwards.
After a while.
Apparently it's restored afterwards, and there's one complaint that it's not working as it's supposed to, as it used to be. So as he said, Cyril said from the beginning, this is psychological. For some reason, we need to find out why, because clinically they've not come for any doctor or physician to say, I looked at it and there's nothing there. And even with that, you have to compare. You have to get
evidence
of it being there already.
Yeah. It's size,
to relate, size to relate,
and all that.
And because Ghana here, we don't really go to hospital a lot, and we don't do more examinations. You can't really. There's no data on file of the person having this and not that, right? So you are right. For it to trigger something like that, and then a chain reaction, and then there's also something called mass hysteria. What is the head? It's called a herd condition, where something happens in the community, everybody sort of feels that herd mentality, like they all want to be part of it. Yeah. Now, some unscrupulous people are using this opportunity to rob people.
Yes, a lot.
Because when the hysteria starts and people are shouting, and a lot of group of people hang around, before you know, your phone or whatever it is gone.
Oh, Charlie, to rob a phone, okay, you have to go through all this headache.
Cause panic, distraction.
If somebody can use all the stress of calling you and trying to convince you that he sent you money. What do you think human beings can go?
Okay, Doc. So at least we've come to understand that clinically it is possible, but not at the rate at which
it's going. Yes.
Yeah, and then even if that the symptoms that will lead to it will take a while.
And very rare.
Yeah, before that happens. Because of time, let me go
let me read this part of the story.
Read it out there.
So the Kaswa one, right?
Into your mic, sorry.
I'm just saying this part of the Kaswa one. So they actually took them to Kaswa Polyclinic, and according to the prosecutor. When they examined one of the guys who was complaining that his thing was finished, he said his manhood was stable and had no defects, contrary to the accused person's claim. Nonetheless, he was given medication, and the other complainant, on the other hand, was also treated and discharged. So, what kind of medication will be given to that effect?
I don't want to say placebo. I was about to say the same placebo. So, have you heard of statements where we have issues? If my colleagues are lazy, they'll tell you we are in situations where somebody will come, and he also knows. He's there. Somebody say, "Oh, if I take medications orally, it doesn't work for me. But when I prefer injection. Injection works for me."
Yeah,
the same medication.
It's the mind.
There could be IV. There could be IV. There could be intramuscular. There could be oral version, like malaria medication.
Yeah.
There's intramuscular. There's IV.
So please I call the person.
Yeah. So you can actually pull just normal saline, like water, the IV that we give, into a syringe and tell the person, this new drug that is come on, it's really good. And then you give the person, and you and I know there's nothing inside, but the patient doesn't know, and the patient will be fine.
So are you saying that?
So basically, there's a phenomenon. Let me help you out. There's a phenomenon that they say when you buy this product, Red Bull. Okay.
Yeah, it makes you fly.
And so considering the dose, then the quantity or the volume of liquid in there is not plenty. When you drink one, it's finished. You want to bring another one. Yeah. They use that to sort of play on your emotions. Like it's a drug, it's a dosage. Drink small. I was watching something online that
effect. We call it the placebo effect. We use it for testing drugs. When you want to bring a drug onto the market, and you want to understand whether a drug works or not, right? You tell a group of people that I take 5 or take 10 people, 5 in one group, 5 in the other group. That don't tell them what the drug is. I don't tell you that Lenny is taking a drug. I don't tell Lenny that you are taking a drug. But I, the one testing, can give Lenny a placebo. It contains water. It's nothing. I can give.
So you are being scammed.
Then I can give you the drug, right? And then we test it in your group and we find out what the results are. It realize that in your group, the ones I give the medication, maybe 4 of them, they worked. The medication worked really well. And then in Lenny's group, 2 of them, it worked. What would you say?
So you are being scammed.
So
no, you're not being scammed. You are being treated.
Your brain, that's why your brain can heal the body. That's why people think that if you think positively, your brain itself can send certain hormones and neurotransmitters to heal you.
Because you believe
in whatever. That's why somebody say, so I don't believe in taking this. I believe in taking that from this person.
Yeah.
Then the person goes to that person and it works.
So life is spiritual. That is why the combination of faith and
there are
medicine
certain things.
works.
I'm a scientist, and I'll tell you this. There are certain things that move around the night and go bump the night. Science has not been able to explain yet. I'll be honest. We are doctors and we are physicians and we help the sick. We can tell you that certain things that we see at the hospital.
Are you serious?
You can do certain tests and you don't see anything. The patient is showing symptoms, he's showing everything that
nothing is showing.
Classic. You do all the tests you want to run out and you see nothing.
Wow.
And then that's when the people come like, oh, my NBP now, like you get what I'm saying?
Yeah.
Then you realize that people come in, the person's faith is built and the person prays and the person is fine.
It's fine.
So
there's always room for that.
Yeah, so I always tell people that medicine and spirituality works hand in hand because one can make your faith grow really well. Right. For example, Luke was a physician in the Bible.
That's right.
I always laugh and make a joke that without Luke, some of the letters Paul wrote from the Bible we wouldn't have seen it because he wrote it in prison. And Luke was the one who was smuggling it out of prison.
Yeah.
So he was the first smuggler.
Yeah, that's true. That's actually true. Yeah.
Okay.
That's actually true.
Wow. So Doc, let's spend the next few minutes talking about the enlargement, elongation, diminishing, and smallishing of
question is, does size matter?
This question is a question for the gods. It's a question that Lenny can best answer.
Lenny nodded like a broken wall gecko.
Miss Lenny, please. Does size matter?
But I mean, I don't know. Lenny, looking at Lenny, a lot of sizes would matter because she's very particular about what she takes. And puts. Lenny is very particular about certain things.
What she puts in her body?
Yeah, like she uses Fenty. makeup, her hair. She goes to one particular barber for her. Like Lenny is very particular. So I'm very sure that in looking at all these things, by all means, when it gets to that.
Let
me watch her from the TV.
You don't look at her face.
Yeah. So we want to ask about that. The people who take these steroids and drugs and stuff to enhance performance. Let's talk about, do they really work? Are there medicines that really, because when you jump onto some X-rated sites, you would find out some of the ads or some of the pop-up that pops up there, you see, animations of this drug, if you take it, then stuff like that. Does it really exist, and do they really work?
So
does it really help build size of?
We have the mechanical aspect, which is the vacuum pump that people have been using.
The vacuum pump?
Yeah. So
yeah.
Penis into a tube-looking thing, and they pump it, and they claim it helps elongate it, right? Then you have the drugs. The first one of note that came up in clinical medicine was found by mistake.
Okay, sorry.
Was found by mistake. The first one to be that I know of.
A drug.
Several back me Viagra. It was supposed to be for heart, right?
Yeah.
It was a hypertensive drug.
Blood flow, but the side effect was that it was also pumping blood. That's why.
So the first time Viagra, the blue pill came up. The supposed blue pill came up was supposed to be for heart conditions, and they found out those who were the old men who were taking, those who were put on the drug, realized that it was enhancing their sex, that was making them stay longer. So they had to repurpose into doing that. So that's where Viagra came from. Then subsequently, over the few years ago, I've been hearing other names that are coming up. The Mr. Q, the Dragons, the whatever.
Okay,
it is,
so does the drug just manage the blood flow in the muscle, or does it really increase muscle size in the in the penis?
So you are going for two things. The person wants to stay hard for longer, right? So there are two things some of these drugs do. Some contain drugs that cause a numbing effect. So there are so many nerves endings on your penis, the tip of the penis, that has very sensitive.
What's the name? Progesterone.
Progesterone. Yeah.
There are so many nerves at the tip of the penis.
Yes, even the length of it, the shaft.
Yes, I'm only repeating it.
Yes,
that's
the
all.
shaft. So that's why the motion, to and fro motion during intercourse. It causes a lot of irritation. Like causes So that causes excitement, and it makes the person feel like reaching orgasm or ejaculating, right? Yeah. Now, in the sense that this drug comes in, this sense that this drug comes in, it numbs the nerves there, so it prevents them from being less excited.
Okay.
So then, because you're not excited, you don't feel anything per se. So you don't get excited, you don't come, so you stay longer.
So it reduces the sensation or knocks it out completely.
Knocks it out completely.
It's a topical anesthetic.
Yes.
So the same thing they use when they want to treat you in the hospital and don't want you to feel pain.
Okay. So it numbs the nerves and allows
that's what they've just
so that's what these drugs do.
Yeah, that's what they do. Yeah. Basically. So yes, the natural the blood is going to rush in there. It rushes in there.
I have a funny story.
Don't share.
My day.
You know what?
No, not my story.
My brother, you already said it.
Not my story. It's not my story.
We agreed on what we feel the story.
We know what's here. We explain me if it's there.
Yeah, that's what. So I have a funny one where the guy takes it. It was whole week. That's why I was thinking whole week. It was funny. It was whole week. The guy takes the thing. Ready, the lady tells I'm coming through. The lady doesn't show up. So now the thing is standing is not. You are not. Let me explain this to those listening. Where your sperm passes through and where your urine passes, the same line, the same road. There's no two separate roads. So like women, one can be run. The two can run concurrently. One has to come before the other. So in the case you've expanded, you've contracted the urethra to be smaller, right? Maybe everything smaller. So now your urine can come out. So it stays. You are retaining urine, and your mouth is standing.
That's painful.
Yeah, it's very painful. And then you have to come in there for us to put in a tube. So the nurse sees this condition. The nurse is like. The nurse sees this condition. The nurse says, "Why? We need to put a catheter. It's a tube that goes into your bladder to drain the urine, right, to help ease the pain." So the nurse is passing the catheter, and the gentleman, the patient, is screaming. The pain. He's in pain, and he says, "You want to hurt somebody's daughter? You will see."
Ouch!
Which is wrong ethically, but you get a picture I'm painting. There are side effects to it. So if the person doesn't come, some have to lie and put ice on it, ice packs on it to reduce,
What should you go to sleep?
No,
does it work?
But
does it ease the?
But sleep. That's the question. If you can
but
force yourself
wouldn't
to
they
sleep.
use any they call them these flashlights or any of these plastic prosthetic female whatever to try and let the person masturbate to?
We don't have that.
Then that's to prevent the person, the woman.
Oh, but you say you don't. You say
No.
they're asking the hospitals.
Doesn't have. The hospital have it. We don't have it.
Okay,
We don't.
so you can bring
maybe
the
I think
person on
maybe
his
sperm
own.
bank can have those
Okay.
because they.
Right.
They need
So
it
my
to-
funny story. So the guy used this progesterone, one of these brands, and sprayed and used blah blah blah. Right? Apparently, you're supposed to let the time pass before you engage, because it's like, I think it's like a spray. So
it's topical.
yes, so the spray was still on his manhood, and then he was being
The delay
intimate.
spray.
Yes, was being intimate, and then the lady, raises her head and is like, you put something on your. The lady's whole face has gone down. What did you put on your?
Oh no!
What did you put on your?
Who said them?
No, it was last minute. The kungu am at your gates.
I mean the one where they say it's stuck inside. People are affiliated to do
Yeah. So if you go somebody's wife.
Yes, we had a discussion with one of my teachers, and we have a discussion about it. And there's actually a clinical explanation for that.
Oh, there is.
Yeah, there is.
So it's not spiritual. It's not juju.
Let's not. I always say that.
Make room for that.
Yeah, make room for that.
But
There's a scientific one too.
Okay.
In a sense that when the uterus contracts, right? In pregnancy, the uterus contracts and relaxes, trying to push the baby out there during delivery, right, of a child. So the same mechanism can work in the sense that during orgasm, the uterus will sort of suck everything out, where it contracts and relaxes, and then causes the space there to narrow, catching the penis in there.
And usually the head of the penis is like a mushroom.
It's a mushroom,
So
so
it
it
locks.
locks.
Yes,
Yes, so it locks.
Like
out.
the way
I say
same in dogs.
usually.
And
yeah.
because
That's what happens
some
with dogs.
with foreskin is
Usually.
not. If you have foreskin,
if you have
it's not.
foreskin, it's not.
It's not.
It's
not everybody's-
That's
Yeah, so
why-
That has
so
the
No.
the best way to do it is sort of like she has to relax, sort of
Foreskin people,
you have
it's
to
just a
calm down, sort of, and
Yeah,
let
good girl, eh?
let it relax for it to come out. But you see, because of the panic of the moment, the panic of the moment, they are both panicking. Someone's trying to pull
Usually
out.
because it's illegal.
It's illegal.
Usually it's illegal. Hey, what did your husband do?
So
That's what happens to dogs
Yeah,
as well.
that's what happens to dogs too. Yeah.
Dogs who have that?
Yeah.
Yeah, dogs will lock up.
Dogs are made to have that.
Oh wow. Okay,
Yeah.
I didn't know that.
That's when you see two dogs mating and they are locked. You don't have to.
Forward count them and trying to
No,
smack them.
yeah,
That's
yeah,
just
stuff
wrong.
like
You're
that.
hurting. You are just causing harm.
Right.
When the BIT relaxes, it will
Let
leave
go.
let
Yeah.
go. And usually by that time, sperm has gone enough.
For fertilization,
So
for it
the
to-
cycle of life.
Then
Yeah, cycle of life.
cats. How do I say? Like, who would want to be stuck?
Now,
Yeah,
cat
you-
doesn't get stuck.
I don't mean cat. I'm just saying catch me dead.
It's because of the size. Because the cat is very
So
thin
this one it is
and long.
the best size win, eh?
Where? In human beings.